Before you can fix something, you have to kind of know what's wrong. And I think for so many years we've been thinking we're not class 1, we're not class 2, we got crooked teeth, it's aesthetically bad. But we really haven't come up with a real disease that orthodontics causes. And orthodontics causes a problem with the bone in the arch. And so when the arch form is wrong, periodontally, we have natural cleansing problems. So if we're able to straighten the teeth, if we're able to make the arch regular, if we're able to angle the teeth in the way that they were designed, we end up with disease reduction naturally, rather than having to do it. So the orthodontitis is a great description, and I think it'll take a little while because there's a lot of folks who are a little slow on the uptake of these kinds of things, but it's sheer genius that we've now named the culprit. We know what the disease is, other than we just don't like the way our teeth look.
Fastbraces for me has been based on science. I've looked into the research, I've seen the university studies that have been carried out with the product. We move teeth differently with Fastbraces, and we look at the alveolar bone and where we need to grow bone to allow the teeth to sit into the right position.
Orthodontitis is the new concept that has been introduced to our profession by Dr. Anthony Viazis, which means the inflammation of the bone, the horizontal loss of the bone that creates gingivitis. And by moving the root of the tooth, we're able to create bone wherever bone was lost. So that's amazing.
We actually have a real diagnosis, a real term for the diagnosis, and the causative factors that come because of that diagnosis. The terms are very descriptive, and once the dentist is comfortable with the terms, the word itis, which is inflammation, can easily be conveyed to a patient so that they can understand that this is actually part of the disease process.
I've been in practice and teaching dentistry for nearly 30 years now, and it's not often you come across something that is truly revolutionary. Now, Fastbraces will get you to think about orthodontics in a different but actually better way for the patient. You'll probably hear terms like orthodontitis, and that will help you focus on where is the real disease, where is the real problem.
Orthodontitis is very appropriate for teeth that have been erupted in the wrong positions, and it actually shows that there is a disease. When you have orthodontitis, it means that there is gum problems such as gingivitis, periodontal disease, tooth decay, and the list goes on, even to medical conditions.
In the past, you're missing bone. Really, the only answer was, a bone graft or a tissue graft to try to replace it by taking it from somewhere else in the body. Well, why not try to stimulate the growth of bone in a way that mimics the natural process itself? It's going to give a better result, better health. It's going to be more stable and more comfortable and affordable for the patient.
Crooked teeth are usually because there's been a disruption in eruption, and that can be because there's not enough bone, for instance, and Fastbraces definitely is a cure for that. Because of its light forces and its revolutionary way of moving teeth, you can expand arches in people who are the right age, and you can grow bone in people of any age, and it's the cure for these displaced roots, for these crooked teeth, and we can make them have enough space.
We're dealing with structure and bone, and we're learning how to correct the defects. We'll identify the defects, and we now have a method where we can help correct them that's quick and easy and efficient.
We're able to identify now the chronic infection, the chronic gingivitis that occurs as a result of this bone defect that we can cure utilizing Fastbraces technology with orthodontics.
A lot of people think that crooked teeth, malpositioned teeth is a cosmetic issue, and it's not. It is a disease, because when your teeth are malpositioned, you cannot clean them properly, and your gums suffer, and you develop periodontitis, which is the #1 cause of tooth loss in adults. A lot of people don't realize that. So once you explain that, and you explain that straightening teeth will help correct that problem, and that you have a technique that will allow them to do it quickly and more affordable, they're more on board. So we are able to treat a lot more people and cure this disease.
One of the things that Fastbraces technology allows us to do is to actually grow bone. And whereas we used to have to take teeth out of the mouth to make room for the remaining, now we just grow more bone to make more room for more teeth, allowing us to do most of our cases without extractions. In fact, I'd say almost all of them.
By giving it an inflammatory or a definition that truly fits it, we can now isolate the problems and have dentists look at it for what it really is.
Fastbraces, the bone sets the tone. With the new technology now, we're able to move the crown of the tooth and the root at the same time.
It is not moving teeth. We are actually erupting them, just like when they first came in the mouth. So by using that light force in the proper direction with this new technology and these new brackets and wire, we can actually erupt that tooth into the proper position.
In the past, we thought that teeth moved through the bone, but the reality is the bone actually grows and grows with the teeth. With gentle forces, the bone understands what's going on as eruption. And with that, the bone is stimulated to grow and allow the teeth to move into those proper positions.
You'll remember this word, orthodontitis. It started here with Fastbraces.